So today's topic is food sensitivity. It is not from your nutrition science textbook. It's in your dietetics textbook. Okay. Not in your nutrition science. It's in your dietetics textbook. Those who have the new version, please mention in the chat box what is the page number. Okay. Page number or chapter number. Food sensitivity. 508 page number. So we'll start today's session. If anyone is joining late, please help them out with the page numbers. Chapter 23, page 508. So food sensitivity, it happens when your body's immune system, which normally fights infections, it will consider food as an invader. Food which is supposed to nourish you. Okay. Sometimes the immune system will consider certain type of specific food as an invader, and it will send allergic reactions. It will start allergic reaction. That is food sensitivity. Okay. Do you think it is the same as food intolerance, food allergies, and food intolerance? Is it the same thing? It is not. Okay. So here you can see food sensitivity and food allergies. So food sensitivity, it will not cause you a life-threatening harm, but food allergy or any allergy can, if it is an anaphylactic shock. Okay. There is a term called as anaphylaxis. Anaphylaxis. Okay. I have mentioned the name in the chat box. Anaphylaxis is it's a shock. The body goes into an allergic shock. If anti-allergen, like an antihistamine, if it is not given on time, the person may die because of an allergy. But food sensitivity is not that serious. Okay. 43% of the population suffers from food sensitivity. It is very common. Okay. Every one of us are sensitive to some or the other kind of food. Lactose intolerance is one of the most common kind of food sensitivity. Okay. And the reaction is delayed. Okay. But not like in food allergy. In food allergy, even if you ingest a part of a food that is allergic to you, okay, in a very minute amount, immediately you will see the effects. Okay, immediately within an hour or so you will see the effects. Okay, but in food sensitivity, the reaction, the way how your body will react to it is much more delayed. Okay, even after 3 days you will find some symptoms after eating some offensive food that your body is not well with. Okay, it's not a deadly condition. Intolerances is not deadly. Okay, you always have an alternative substitute. Okay, so most common symptoms that you see in food sensitivities, it is bloating, joint pain, IBS, irritable bowel syndrome, tiredness, eczema, low mood, headache, weight gain. Weight gain, it feels like your entire body is swollen up. Okay, it's not deadly. And the most common sensitivities, it's like wheat, gluten, milk, or any dairy products, corn, eggs, sugar. Okay, you can have multiple food sensitivity as well. Okay, one person may be lactose intolerant as well as gluten intolerant. Okay, it can happen. In food allergies, from a very young age, you will be allergic. And usually, what we have seen is children from a very young age, from infancy, okay, from toddler age, if they are allergic to certain types of food, by the time they grow into teenagers, usually they outgrow their food allergies. Okay. Usually, whatever allergies you had as a child, that will subside when you grow up. Okay. But food allergies that you have picked up in the later stages of life. Okay, maybe as a teenager you became allergic to certain food. Okay, earlier it was not like that, but as a teenager or as a young adult, you became allergic to certain types of food. It will stay with you. That kind of food allergy will stay with you lifelong. Okay, but we have seen usually children outgrow their allergies, food allergies. Okay, and it could be deadly. Even trace amount of food, very minute amount of food, can trigger some life-threatening reactions, allergic reactions. For example, in some specific kind of allergies, your throat shuts down. Okay, your windpipe, your trachea. Okay, it blocks itself. It undergoes congestion. Okay, constriction. So the air will not be able to reach the lungs, and that's a life-threatening condition. Okay, so most common types of allergies: peanut allergy, any form of nut allergy. Okay, tree nuts, peanuts, cashew, almond, coconut. Okay, eggs, milk, shellfish. Seafood allergies are also very common. Okay, people who are allergic to crabs, prawns, okay, squid, etc. And it is very rare that you are allergic to more than two food. Okay, it's a very rare condition if a person is allergic to more than two food. Okay, so that's the basic difference between sensitivity and food allergy. Coming to adverse reactions to food, the way how your body reacts in an adverse way to food, it could be toxic and non-toxic. Toxic means by mistake, if you have ingested something that is very toxic, okay, something that could be poisonous. Okay, so that is also an adverse reaction. Okay, maybe your food got mixed with some chemicals. Okay, too much of higher than the like, for example, recently few years back, Maggie had that lead toxicity case, right? So that was toxic. Okay, so people's body would start showing adverse reactions if you over consume Maggie. Okay, so that was seen many years back. Okay, so that is a case of toxicity. Okay, non-toxic reaction. Okay, do you think peanuts are toxic? Do you think milk is toxic to human body, or peanuts, or wheat? Do you think these foods, which are commonly we call them as common allergens, are they toxic to human body? They are not. Okay, but sometimes the body reacts towards that food, that it is kind of a pathogen. It is a toxic thing that you have put in the body. Okay, so in non-toxic adverse reaction, you have non-immune mediated and immune mediated. Okay, non-toxic reactions could be in two ways. Okay, non-immune mediated and immune mediated. Non-immune mediated means what? Your immunity is not playing any part in it. Okay, apart from immunity, there are other things in your body that helps with the digestion. Okay, so your immunity is not triggering any adverse reaction. Okay, just maybe you don't have certain enzymes like lactase. Okay, lactase enzyme is nowhere related to your immunity. Okay, if your body does not produce lactase enzyme, you will be lactose intolerant. If you have some dairy product, milk, okay, your body will show adverse reaction. Okay, so that is enzymatic. One type of non-immune mediated is enzymatic. Okay, certain enzymes you don't have in your body. Okay, maybe by birth or maybe after certain age, your body stopped producing these enzymes. So you become sensitive to that food. Okay, so that is enzymatic. Then pharmacological. Okay, if you are taking some drugs, okay, you are on certain medications that may react with certain food in an adverse way. Okay, we say that if you are taking these medications, please avoid consuming milk at while you are taking these medications. Okay, there are certain examples of certain drugs. Okay, that the doctors will, while prescribing, they will give you the guidance that don't mix food with this medication. Okay, for example, thyroid medications, don't take it along with food because it will inhibit the absorption of levothyroxine. Okay, so just like that, there are various pharmacological medications which may adversely act with the food that you're consuming. Here again, your immunity is not interrupting. So these all are non-immune mediated. And usually when immunity is not involved, okay, whatever signs and symptoms you will get is gastrointestinal. Okay, it will the bloating, nausea, vomiting, diarrhea. Okay, these kind of reactions will be seen. Okay, you will not find rashes and all that kind of reactions. You will not see. Only those kind of reactions will come only when your immunity is involved. When immunity is not involved, it's strictly gastrointestinal symptoms that you will see. Okay, so when immunity is involved, it's an immune mediated adverse reaction. Okay, so usually it is your IgE. IgE means immunoglobulin A, okay, or T cells. That is type 1 type of immune response. So here IgE or T cells of your body. Okay, these are IgE T cells. These are segments of your immunity. When we will do the immunity chapter, infections and immunity chapter in detail, we will discuss this. Okay, so right now understand you have immunoglobulin E. That's a part of your immunity. T cells again, very important part of your immunity. Okay, in type 2 and type 3 kind of immune response, it's not clear yet which kind of cells here are involved in giving you an adverse reaction. Okay, in type 4 only T cells are responsible for giving you an immune reaction. Okay, like celiac disease, food protein induced enterocolitis. Okay, celiac disease is what, in which your small intestine, the long finger-like projections of the small intestine is not long. It has become flattened and short. So there is no absorption. Okay. And in celiac disease, you have to avoid gluten. Okay. Because when you have gluten, it aggravates the celiac disease. Okay. It destroys it destroys more and more intestinal villi. Okay, so that is celiac disease. So in celiac disease, type 4, it's a type 4 immune response. Then you have innate immune responses, which is your body's immunity that you're born with. Okay, that will try and understand that a food is a pathogen and we have to tackle it. In adaptive immunity, what the immunity that you're not born with, okay, the immunity that you have gained over a period of time, those cells will attack the food as a toxic pathogen. Okay, in innate immunity, maybe it's your mucous membrane that you are born with. You are born with a mucous membrane. You are born with certain enzymes. Okay, these things will understand that this particular food is harmful to the body, so let's attack it. So that is innate immune responses. Okay, so usually the IgE mediated food allergies, dermatitis, esophagitis, enteropathy, allergies towards egg, milk, peanut, tree nuts, shellfish, any kind of seafood, soy, wheat. Okay, these all comes under adaptive immune responses. Within 30 minutes, the symptoms will start. Okay, and sometimes after within 2 hours also the symptoms will take time, and the symptoms will start within 2 hours as well. Okay, so adaptive immunity, the response is very quick. So foods that are involved in sensitivity, certain types of animal sources, from animal sources, it's the milk. Okay, cow protein, cow's milk, specifically cow's milk. A lot of children are allergic to cow's milk. Red meat like beef. Okay, beef allergy and all, it's more common among adults, not in children. In children, cow's milk, okay, there is a specific protein in cow's milk called beta lactoglobulin. Okay, so children are allergic to that. And in meat sources, red meat, specifically beef, okay, and all your seafood. Okay, usually it is shellfish, prawns, crabs. Okay, these are the most common seafood allergy is seen. Fishes are much, fish allergies are not that common, but these kind of seafood, okay, it's very common. So that all comes under animal protein, animal sources. Under plant sources, soya protein allergy, it's also seen that children who have cow milk sensitivity, okay, cow milk allergy, children who are allergic to cow milk, they are also allergic to soya milk, okay. But once they grow a little bit, they grow up a little bit, they are still allergic to cow milk, but soya protein they can still tolerate in later stages of life, okay. So soya protein is also an allergen. Peanuts, cocoa, peas, okay. Some citrus fruits, some spices as well, okay. And in wheat, if you see cereals, wheat, anything that has gluten, okay, any kind like barley, wheat, rye, barley, they have gluten, so people are allergic to that as well. So those all comes under plant sources. Beverages, any beverage that is made up of cereals, for example, if we take beer, okay, beer is made up of what? What grain is used to make beer? Yeah, barley. So anyone who is allergic gluten, people who are allergic to gluten or allergic to barley, they will also be allergic to beer. They can't have beer. Okay, if somebody is allergic to the citrus fruit of red grapes or green grapes, they can't have wine. Okay, so these are the beverages that people may be allergic to. Fermented food, a lot of yeast allergy is seen. Yeast. Okay, so they can't have bread which is fermented using yeast. And also in beer also yeast is used. Certain for fermented drinks, yeast based fermented drinks are made. Okay, so that cannot be that also has to be avoided. And then we have certain food contaminants, like certain preservatives used in packaged food. Then Ajinomoto, that is MSG, monosodium glutamate, Ajinomoto. It's usually used in Chinese cooking. Okay, so that is also a common cause of allergy. Certain flavors, artificial flavors that are used, grade 1, grade 2 preservatives used. Okay, that can also cause allergies. Raisin is not a fermented food, but raisin is a dried form of grapes. Okay, so if you're allergic to grapes, you will be allergic to raisin as well. So coming to symptoms, skin manifestations. I have shown a picture here. This is urticaria or hives. Okay, when so this is a form of allergic reaction. It can happen anywhere. Okay, neck, elbow, forearm, entirety of your back, chest, okay, face, anywhere in your body, hives can happen. It's very itchy as well. It will be red, swollen areas, okay, swollen bumps here and there. It will be irritating, itching as well. Okay, so this is called hives or urticaria. Okay, another name for it is urticaria. It may be mentioned in your textbook as well, urticaria. And some other form of skin manifestations of allergic symptoms, lip swelling, okay, and then angioedema, that is your blood vessels will dilate, okay, itching, rashes, eczema, okay, these are the other skin manifestations seen. Then your gastrointestinal manifestations, what symptoms you see here, nausea, vomiting, diarrhea, some malabsorption, intestinal blood loss, okay, blood in the feces, pain in the stomach, abdominal pain, bloating. Okay, these are the GI manifestations seen. Then respiratory, certain allergic reactions, continuous sneezing, okay, and rhinorrhea. Rhinorrhea means runny nose, just like how we spell diarrhea. Rhinorrhea spelling I will just put in the chat box. I'm not sure if it's there in your textbook. Rhinorrhea, it means runny nose. Okay, just like how you, if you have cold, how you have a runny nose. Okay, after continuously sneezing. Okay, people who have dust allergy, they continuously sneeze one after the other. Okay, at least 10 to 20 rounds of sneezing will be there, and runny nose will be there. Okay. Rhinitis is different from rhinorrhea. Rhinitis, it is inflammation. Okay. The mucous membrane of your nose, inflammation will be there. That is rhinitis. Rhinorrhea means runny nose. Okay. Then wheezing sound like asthmatic patients. Okay, when they have asthma attack, if you have heard the sound of their breath, okay, there is a faint whistling sound. Okay, that is wheezing. Cough, bronchospasm. Bronchospasm means the trachea closes up. Okay, because if the trachea, it's a windpipe, if the windpipe undergoes swelling, okay, the airway reduces. Okay, airway is the passage, is a passage through which air can freely move. If the passage reduces in size, okay, very less amount of air can reach up to your lungs. Okay, so that is bronchospasm, and because of which you will have dyspnea. Dyspnea means breathlessness, difficulty in breathing. Okay, bronchospasm and dyspnea. Spelling I have mentioned in the chat box. Okay. So these are the respiratory symptoms. Neurological symptoms are very rare. It could be an headache, okay, feeling of apathy, okay, irritability, feeling of apathy. Okay, sometimes in severe cases of allergy, person may go into a state of delirium. They do not know where they are, confusions and all. Okay, state of confused mind will be there. Those things are neurologic. Sometimes you will have tremors. Okay, tremors are also neurologic. Your hands will shake vigorously out of your control. Okay, so those things are neurological symptoms. Then systemic symptom, overall, what other symptoms you will have? You may go into anaphylaxis, as I mentioned earlier. Anaphylaxis is a life-threatening reaction, hypersensitivity reaction to food, hypersensitivity, allergic reaction to food, which could be life-threatening if immediately medication is not given or immediately a medical attention is not given. Because of anaphylaxis, a person may die as well. Okay, their windpipe has closed, is closed, their entire face is swollen up. Okay, the face becomes disfigured and swollen up. So immediately, if they don't get a shot of antihistamines, okay, the person may pass away as well. Those things come under systemic symptoms. Some people will have joint swelling, joint pain, overactiveness. Okay, so these are the symptoms. Is it clear to all? So coming to diagnosis, you can take a dietary history. Okay, if you come across a person who have uh, any food allergy, okay, a dietary history can be taken, what they have eaten so far from the past 3 days, what all food they have eaten, if they can recollect. Okay, if they have kept a food diary, it is much more easier for them to understand. Then you can do a provocative test. Provocative test is slightly dangerous. Okay, it should be done only under medical observation and medical guidance. Okay, a food that you think is causing allergy, a very small portion of it you will ask the patient to ingest. Okay, and you will wait with all the anti-allergic shots ready. Okay, you will see how the patient's body is responding. You will wait it, so that you are provocating the immune system here. Okay, that is why this name is provocative test. You're provoking, you're taunting the immune system to react, to identify, okay, this is the exact food that is causing allergy for this person. Okay, so commonly the most common allergic food are usually used. One second. Yeah. The most commonly known allergic food are used here to do provocative test, or even from the patient's food diary. Okay, whatever they have eaten and what is suspected to cause allergy, that food sample will be used again to provoke the immune system. Okay. Then elimination diet. So this is a very long process. Okay, elimination diet. Here on day one, you will remove all the milk from the patient's diet. Okay, and if the allergies and the intolerances still exist, then you will remove all the soya products. Okay, and again, if the intolerance and sensitivity is existing, you will remove wheat from patient's diet. Slowly, step by step, one thing at a time will be removed from the diet. Okay, that is called elimination diet. You are eliminating one thing after the other and checking how the patient's body is responding. Okay, so that is elimination diet. Then laboratory testing. There is a lot of blood tests like total serum IgG test. Okay, RAST test, radio allergo sorbent test, skin prick test. Biopsies can be done in a piece of your intestine will be removed. Okay, intestinal biopsies can be done. Malabsorption studies can be done. Okay, there are a lot of laboratory tests that can identify your allergy. Okay, in skin prick test, a small cut is made on your skin. Okay, a very small abrasion is made on your skin, and a food that is supposed to cause allergy, that food is placed on that small cut, and you wait out for the reaction. Okay, these are skin prick tests. These are done in the clinical setting, in the laboratory setting or clinical setting. Okay, so these are the laboratory testing, and there is a 40 injection method as well, in which around 40 in 40 places all over your arm, your inner arm, okay, or on your back, either on your inner arm or on your back. They will inject you, they will give you intradermal injections. Okay, intradermal injection do not penetrate a lot. Okay, they are just below your skin. Okay, so in different parts, intradermal injections will be given and those sites will be marked. Okay, and within a day or two, you will have to wait it out, or within few minutes only, that area wherever a specific and a specific allergen based injection was given, if that area reacts, it means it is confirmed that you are allergic to a specific food type. Okay, not just food allergies, dust allergy, pollen allergy. Okay, these different kind of allergies. Okay, some form of most common causes of like aloe vera allergy. Okay, allotonin allergy. These are used in skincare and all. Okay, but people are allergic to it. Even hyaluronic acid. Okay, which is very commonly used in skincare, but people could be allergic to it. Okay, so these allergies can be ruled out using the 40 um, intradermal allergy test. Okay, these are the different types of laboratory testings. In children, you have to do elimination diet. Okay. In children, most commonly it is peanut allergy, cow milk allergy, protein allergy. Okay, cow milk protein allergy or soya protein allergy. These are the most common allergies seen in children. Okay, so elimination diet will through elimination diet you can find out what kind of allergy the child was having, or in children, ask the parents what was given to the child in the past 3 days. Help the parents to recall what was given to the children in the past 3 days. Yeah, in blood serum IgE test is done to find out allergy. Treatment is elimination diets. Okay. Elimination diet, as I mentioned earlier, you have to remove one food at a time. Okay. Because if you eliminate a lot of food together at once, that could lead to malnutrition. Okay. So once you understand which food is offending your immune system, once it is identified, only that particular food should be removed from the diet. Okay. So that is elimination diet. Remove that food allergy causing um, food allergen from the diet completely. Okay. And don't remove any other important aspects from their diet. Otherwise, it would lead to malnutrition. Then you have denaturation of protein. Denatured protein, that is, let's say, hydrolyzed protein. Okay. Hydrolyzed collagen, hydrolyzed protein, that is given. Okay. Because if a person's body lacks certain enzymes that can break down protein, why give the complete protein? Okay. Give the broken down protein to the patient so that it becomes easier for the patient's GI system to break the protein further in a very easy way and absorb it. Okay, that is denaturation of protein. Then hypersensitization. Uh, it's risky. Hypersensitization is kind of risky. If you're exposing the person too much to the allergen, okay, so that could we can't be very sure of, but that could lead to a situation where the patient has overcome the allergy. Okay. So that is hypersensitization. It's a process of hypersensitizing. Okay. Especially if you have an allergy or any or if even if you have certain phobias, food phobias. Okay. In that also, people, food phobias means you are afraid, you are scared of a specific kind of food. Okay. In those cases, hypersensitization may help. I think Swapna Lad had undergone hypersensitization. If you can give a brief of your experience in the chat box, it would be helpful for other students to know as well. In the chat box, if it is possible for you to write down a brief on your experience with hypersensitization, that could help others to understand what exactly a person suffering from certain form of allergies they undergo. Even with food phobias, usually food phobias or any form of phobias, to treat that, psychologists will use hypersensitization as a treatment. And in drug therapy, drugs that you can use is antihistamines, certain prostaglandin synthesis inhibitors. Like aspirin can also be used. So the role of drugs in food allergy is very limited, okay? Apart from antihistamine, other drugs are still under test, okay? Okay, so the hypersensitization treatment went on for 6 months for Sapna Lad. IgE test is the immunoglobulin test, okay? Once you do the IgE test, serum IgE test is done. Okay, the laboratory test is total serum IgE test. Okay. Total serum IgE test is done to understand what is the level of immunoglobulin E in your blood serum. Okay, and what type of immunoglobulin E has been released from your blood serum. Okay, so based on that, a food allergy can be traced. So in drug therapy, usually antihistamines are given. Oral disodium chromoglycate is also useful in children, especially if they have asthma-like symptoms. Certain other medications are still under trial. They are not out in the market for use, but a lot of anti-allergic drugs are under trial. Rantac also can be used if you have a non-immune mediated reaction, in which only your GI system is undergoing bloating. Okay, you have stomach pain and all. In that cases, nausea, vomiting, you can take Rantac, ranitidine. Okay, it's an H2 receptor inhibitor. People can have adverse reaction to antihistamine as well. Okay, if you have some numbness in your system after taking antihistamines, certain steroid based medications can also be recommended. Okay, so recheck your medication with your specialist. Okay, specialist has to know if any adverse reaction are being caused by the medication prescribed. Okay, so a substitute can be given. Then dietary advice usually ask the patient uh, to read the ingredients well before purchasing something. If it is a packaged food, if they are purchasing, read the ingredients well while purchasing certain food. And also like Ajinomoto or MSG and all, okay, they may not mention it as Ajinomoto, MSG. Okay, they will call it, they will just behind the food packaging, they will just put it as monosodium glutamate. Big words will be mentioned. Okay, so as a dietitian or a nutritionist, you have to clear these big names to your client. Okay, if you see this particular name in the ingredients list, avoid it if you're allergic to it. Okay, no, histamine is not directly connected to gut health. Your gut health is connected to your overall health. Okay, histamine is released from the mast cells. Okay, basophils and all, they all release histamine when there is an allergic reaction. Okay, so what antihistamine does is antihistamine will cover up this histamines that your body is releasing. Okay, so that symptoms can be stopped. So the difference between food intolerance and food allergy. Food intolerance, your symptoms are like bloating, diarrhea, nausea, indigestion, aggravation of asthma or eczema. Okay, so it's usually GI symptoms and very rarely respiratory symptoms. And it occurs when you are unable to properly break down certain food because your body does not produce a specific enzyme to do that metabolism, and it is not life threatening. Okay, certain pills are available, certain enzyme pills are available. Okay, so for example, those who are lactose intolerant, if you are going out with your friends for a pizza party or something like that, okay, you can't be the odd one out, you want to be the part of the crowd, you want to be the part of the group. Okay, but you're lactose intolerant, so in such emergency situations you can take lactase pills, lactase tablets are available. Okay, just before having some pizza that has cheese, cheese has lactose. Okay, it will cause bloating if you don't take the medication, so you can pop the lactase pills and then drink milkshake or have some lactose based food. Okay, that will not cause you any harm. Okay, so in emergencies some enzymatic pills are available to help the body break down certain food which enzymes your body can't produce in the medication format. Those enzymes are available. Okay, but food allergy symptoms are like hives, urticaria, itching, swelling, vomiting, diarrhea, nausea. Okay, it occurs because your immune system is identifying a food as a pathogen, as an invader, and it could be life threatening, it has the potential to be life threatening. Okay, that is the main difference between food intolerance and food allergy. But what are the similarities between both? There is no specific cure for either intolerance or allergy. You have to live with it. Okay. But there is a chance that both may resolve itself over time. Okay. As your child grows older, as I have mentioned earlier in this class, food allergies seen in children, they usually outgrow it. Okay. Why the body makes little or no particular enzyme, or why the immune system is responding adversely to certain food, is still unknown. Okay, we do not know the root cause why your immune system is hyper triggered or why your body is not able to produce an enzyme. It could be genetic as well. Okay, basically foods that can trigger intolerances can also be the food that can cause allergies. For example, as a child, if your body was not able to digest eggs, seafood, nuts, dairy, wheat, and all, when you grow up, you can develop an allergy towards these specific food. Okay, so that these are the similarities. So FODMAP questions regarding this will come in exams. Okay, FODMAP, the full form is fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. Okay, this is the FODMAP diet. So these are short chain carbohydrates that your small intestine cannot absorb properly. Okay, so these kind of food you generally have to avoid. Okay, those who have intolerances, food allergies. Okay, these are short chain, these are not long chain. Okay, long chain carbohydrates, it takes time for your intestine to break it down. Okay, and it will not immediately, it will not increase your blood glucose levels. Okay, but these FODMAP food, if you avoid, it will be better for your health, specifically for those who are diagnosed with sugar-based allergies, lots of food intolerances. If you avoid these specific kind of food, it is better. That is FODMAP food. Avoid the FODMAP food. Okay. And especially this FODMAP diet was designed for people who have irritable bowel syndrome. Okay. And if they have any intestinal gut overgrowth, okay, microbiome in your intestine is overgrowing, in those people as well, FODMAP diet is helpful. And it is usually temporary. Okay, it's a very temporary eating plan. Once your IBS has cleared, okay, your intestine is responding well to food. Okay, once you have controlled the amount of gut bacteria that you have, you can go back to your normal diet. Okay, it is restrictive. It is a very restrictive kind of food. A lot of food will be avoided from your menu plan, diet plan. Okay, but it is for a temporary period of time. And you should not follow the FODMAP diet for very long. Otherwise, it could lead to malnutrition. And even for people who suffer from digestive distress, okay, like very regularly you suffer from cramping, diarrhea, constipation, stomach bloating, gas, farting, flatulence, and all. Okay, you have these issues. You can follow FODMAP for a few weeks. In FODMAP, it is a 3-step elimination diet. Okay, in first step, completely stop this FODMAP food. Okay, oligosaccharides, disaccharides, monosaccharides, and polyols. Okay, completely stop them. Then in the next step, slowly introduce them one by one. Okay, maybe in the first few days you will introduce bread, then you will introduce legumes, then cheese, then yogurt. Okay, slowly, one day after or 2 days after introducing one kind of food, introduce the third kind of food. Okay, so like that, slowly reintroduced each food. Then you will find out which are the food that is causing you most issues. Okay, once you identify this food that causes you harm, you have to avoid them or limit them. So when you are on a FODMAP diet, you can take a screenshot of this slide. Okay, if you are recommended to be on a FODMAP diet, what are the vegetables and fruits, okay, what you can have? Vegetable, fruits, dairy, protein, grains, sweeteners, okay, nuts, what you can have. These are the list that you see on screen are what that is allowed in your diet if you are on FODMAP. Okay, in dairy you can see they all are lactose free. So that's about food intolerances. If you have any queries, please mention the chat box.